so OPPIEJ. And she wears a dual hat. So her second hat is she's the interim director. My office works very closely with her office on tribal activities within our center, as well as environmental justice activities. So the reason why I am here today is to learn. We have been working on the tribal environmental health summits with my colleague, your second, Audrey, and with our partner, National Indian Health Board, for how many years now? Yes, for about a year and a half. And we were hoping to convene the summits before COVID. 2019. Audrey just corrected me. She said 2019. And that is, so I did our third summit for this fiscal year. Our first one was in Oklahoma City, Oklahoma. Our second one was last week? Time is just running together in Phoenix, Arizona. And then our last one for this fiscal year will be next week in Green Bay. So growing up, my grandparents and my mother used to tell my brother and I every day when we left the house, when you come back home, I want you to tell me 3 things that you learned and how you're going to apply it and what to do for the rest of the day, for the rest of the week. And so every day we came in, we were hoping that she would forget. No. So I still carry practice to this day. So I'm from the first 2, and I've been thinking about how I can take those learnings and implement that into the work every day. So I'm going to
I am here also to learn and to hear, as Donata was saying, we've been working on, when we conceived idea for, we wanted to go and speak with tribal communities to find out, you know, if we should hold a national summit. We got back the word that regional summits would be the best way to go.
I'm Anita Benz. I work for Rocky Mountain Tribal Leaders. I have a dual position, good health and wellness in Indian country as a tobacco coordinator under CDC grant. And then the new EPA grant that we received on the program coordinator for working with tribes, water testing for lead. Thank you.
Hello, everybody. My name is Ria Schommelmeyer. I also work at CDC and CEH, ATSBR. I work for Shorta Buchanan, who was mentioned earlier, and who is actually attending virtually. And I work in the Office of Priority Project Innovation, helping coordinate these summits, but I have not been working on them here. That's only a couple months for me. But I'm just here to make some connections and learn from you all. Hi. I'm a health scientist for the CDC today. We can hear more about the work that we're doing there, specifically around tribes. And so the primary health program is within CEH, the National Center for Environmental Health.
My name is Janice Archuleta. I'm representing the environmental community. Other applicable departments from the Ute Mountain Ute tribe, and we are in the Four Corner with lands in Colorado, New Mexico, and Utah.
Really interested to hear what you're talking about.
Hi, my name is Belinda Bolshan from the Blackfeet Tribe. I'm here to learn the information that's going to be given today, especially just what the gentleman talked today about, and see what resources we can bring back to our tribe.
Hi, everyone. My name is Dawn Nelson. I'm a state toxicologist with the Department of Public Health and Human Services in Montana. I manage the environmental health education and assessment section within the Scientific Support Bureau. These long titles. I'm here today for two reasons. One is I was invited to be on the panel to speak about DPHHS programs and specifically my program and how we have an impact with the tribal communities. And second reason I'm here is really to learn and to meet people. I'm relatively new to public health. In fact, our entire team there is a team of 4, and I'm the section supervisor. So I'm here as a representative of DPHHS as well as we have a cooperative agreement with ATSDR, and we are really boots on the ground for them, and we partner with them with all kinds of projects.
My name is George Ruben.
Nalani Hankwaya Washki. This is only in Bannock. My name is Claudia Washki. I'm from the Shoshone Bannock Tribe from Fort Hall, Idaho. I serve on the Fort Hall Business Council. And I'm here to, I particularly want to learn about the Safe Waters initiative simply because hopefully the Fort Hall Reservation is known for potato growing. We actually have 60% of the nation's potato growing on our reservation, and currently right now we're suffering from our water wells are drying up, particularly from overuse of our farmers watering their fields and whatnot. So and a lot of our wells, our household wells have EDB in them. And so we're trying to initiate some sort of issue of getting our farmers into compliance with the pesticides that they're using.
Good morning, everyone. My name is Edward B. I'm here, Navajo. Working for national for quite some time. I'm also relatively new to public health, and the more I immerse myself, the more tool kits that I walk away with, and really I'm trying to work this into the NGO that I'm working with, election system solutions. So I'm transitioning some sustainable back into public health and environmental health and a lot of climate policy. And getting to introduce yourself and I'm actually 40 miles from Toga. If I 4 corners to not community, so I'm looking at that community as well. So meet you all. Thank you.
Good morning, everybody. My name is Sandra Holden, from the protective station. I was in the treatment center there, and I'm just here to learn everything about this environment. Thank you. And we Stevenson from Fort Peck, and I'm just here to learn. And I look for the work program.
Good morning, everyone. I'm Jerry. I'll do a short presentation tomorrow. Answer some of the questions. If you have additional questions, we can try.
Hello, I'm Valencia Williams. I'm also with the Office of Grid Services. So do what Tina's just shared. Shay!
Hi, all. I'm Kai Elgatoon. I'm the Region 8 Director for ATSDR. That includes Montana, Colorado, Wyoming, Dakotas, and Utah. And so I'm a point of contact locally for a lot of you for goods and services and things that ATSDR can quickly provide for you. As you may or may not know, ATSDR is a rather small agency. So office in Denver has just 2 scientists right now, but we do have a lot of capability to reach back to our headquarters and help. And right now we're engaged helping Ute Mountain Ute tribe one of their sites in Utah. So tomorrow I'm doing the brownfields land reuse program at TSDR that I've also been involved with for many years, specifically in Colorado. Thank you.
Hi, Lori Byron with Montana Health Professionals for Healthy Climate, but I was a pediatrician at Crow for a million years and got one of the best things ever with an update from ADA on one of my old patients who's her son and just a wonderful human being.
There, I'm Troy Ritter. I'm on the water team at CDC's National Center for Environmental Health. And before coming to CDC, I worked for the Indian Health Service and then 3 different tribal organizations: the Alaska Native Tribal Health Consortium, the Yukon Pacific Health Corporation, and then the Native Association. My career has been really devoted to the water and tribes, and I'm going to speak on that this afternoon. Thanks.
Okinitaka. We go through all the tribes here in Montana, Wyoming, and Rocky Mountains. So if I mispronounce things. Okinitaka, Sanitapi, Tansegwa, Mombawashte, Usu, Ihaniwashte, Miyake, Zambetshu, Shodaje, Ichik, Diawakum, and Tibuana, Medinda Mwachta. And in Polish, Jim Dover. My name's Gino Nacco. I work for the Bureau of Indian Affairs right here in beautiful Billings, Montana. I'm currently the Safety of Dams Officer. I'm also a professional licensed environmental engineer, and I've also been engaged in disaster emergency response within the region and on a national level. I'm kind of a Swiss Army. And my given Indian name is Whipped Dog.
Hello, I'm Casey Sorrell Villarreal. I'm doctor, but I work on bioconservation with CSKT Tribal Health. I'm a public health educator. Brian Crawford invited me to come to this. I've never gone to one of these before, so I'm just in the process of learning everything and gaining a lot of information, but I'm really enjoying what I'm learning today, and I can't wait to kind of be a part of everything. So thank you.
My name is John Doyle. I'm a frequent college member of the Core Environmental Health Steering Committee, and working in water quality for the past 20 years.
Hi, I'm Tim Stewart. I'm also with the Health Steering Committee, and I'm also I'm Laurie Eggers, also with the Environmental Steering Committee, and environmental scientist at Montana State University. This process, we have the only accredited environmental practitioners now in the Northern Plains at MSU Bozeman. And if you have students in the tribe that you want to have them get that degree and come home and be able to use those skills, people, I will take really good care of them. Please introduce them to me. I will mentor them and help them find scholarship funding. And we have excellent students like Billy, who's a senior and will graduate and super really proud of them. Yes, I'll be back soon and check. No, sana başı çiğ, kuru çiğ, başı çiğ, no, sana başı. I'm Navajo and Crow, my name is Audrey Jackson, I'm born from Colorado House. We're Crow. I'm Dula, an Indigenous Dula in the Christian Counselor, and a CNA, and I'm just here to learn more.
Hello, everyone. My name is Marvin Jr. for West. I'm representing the Crow tribe, and I am the director of name's Quentin Lick, and I'm here for the East Shoshone tribe. I've had several years of experience with 106 water quality, water quantity, water distribution, different things. So they're currently I'm looking for the public health program for emergency preparedness and response, basically. But I'm here for the lead water testing thing for the schools and stuff like that. So, we have exploded guys here from my area. State surgeon is really good. Also, there's some that Cordell Snyder, he's our assistant for the lead water testing. And I hope it all works out. Get some remediation at least. Hopefully.
Sometimes you have to think about what you're gonna say. And one of those things is what I was thinking about. I'm a former member of AIM. I'm also a honorary councilwoman for the Blackfeet tribe. I'm a language teacher, Blackfeet language teacher for 32 students. My purpose here is to learn more about what's happening these days. In my lifetime, I've attended a lot of meetings, a lot of things, and learned a lot, but things have changed, modernization took place, and I need to keep up on that. I'm 81 years old, but I'm still learning, and I thank everybody for being here today. Thank you. Good morning, everyone. I'm Cinda Ironmaker. I work with Rocky Mountain Tribal Leaders Council, and I am an enrolled member of the Blackfeet tribe. I'm the tribal public health specialist. And I am also here to learn, just in this morning. We were invited yesterday. And I have learned so much just in this couple of hours that we've been here, and I'm so glad to be here. I didn't know how much pertained to my work as a tribal health public specialist, but that title means nothing because I'm all over the board. I'm all with everything, and everything that we have discussed definitely pertains to, and I'm in the right place today. So thank you for having me. Thank you for the invite.
Good morning, everyone. My name is Lisa Evers. I'm the Tribal Relations Manager for the Montana Department of Public Health and Human Services. So I am here to do a presentation after lunch, try to keep you guys awake after lunch.
I take it, Darby Wingone, my name is Darby Gallagher. I'm a member of the Miami Tribe of Oklahoma. And I am our communications coordinator for the Colombian Health Board. So you see me walking around, take a bunch of pictures and videos of you all. So I'm trying to keep your camera faces ready.
Hi, everyone. I'm Brett Weber. I'm National Indian Health Board's Environmental Health Director. NIHB just celebrated our 50th anniversary last year, and I am our first Environmental Health Director. So we're building out this work, and I'm here today, as Donata said, to really hear from tribes about what the need in this area is, and also hear from our federal partners, what do they need to get their resources out to Indian country, because there's no reason that a single dime should not be sent out to Indian country. So really looking forward to today and tomorrow. Thank you. Thank you.
Hello, I'm Davis Fearden. I work with the Indian Health Service at the Fort Washakie Health Center on the Wind River Reservation. I hope to learn from today. I just been seeing what other environmental health things are going on in the Billings and Rocky Mountain areas. Wind River Service Unit is the only reservation in Wyoming. So sometimes we're like, oh yeah, there's like 6 in Montana. We want to see what's going on in these other reservations. I'll also be inspecting the food trucks at the Pro Fair today in the next few days. I can't tell you which one's to or not to eat at, but if you ask me, I either frown in one direction or smile in another. Just let that mean whatever you want it to mean. So thank you very much.
Hi, everyone. My name is Leanna Christensen. I am the events and meetings coordinator with NIHB. And I'm here to make sure everything runs as smoothly as possible. So if anything goes wrong, don't blame me. Hi, everybody. I'm Eliza Bowling. I'm the CDC Public Health Associate Advisor assigned to NIHB for their environmental health team. Really excited to be here. Nice to meet you. Oh, if you need travel support and assistance, come find me at the table in front.
I think we couldn't introduce her next session.
I'm also introducing the speaker, so let's get on with the next session. So, next session we have is lead poisoning and prevention session. And this session is going to be talking about the sources of lead exposure, specifically in lead-based paint, drinking water, contaminated soil, and consumer products, and how lead exposure can happen through jobs or hobbies. Tribal lands are often in rural areas where there is a higher risk of lead poisoning and lead exposure. So there's lead screening, prevention programs, and that are critical to address specifically childhood lead exposure among American Indian and Alaska Natives. The presenters, Mr. Joseph and Ms. Ada, will be talking about how to reduce childhood lead poisoning as a public health problem, specifically through strengthening blood lead testing, reporting and surveillance, and linking exposed children to recommended services and targeted population-based interventions. Mr. Joseph is a senior epidemiologist and team lead for the lead poisoning prevention and environmental health tracking branch of the CDC. And Ms. Ada Billings is a tobacco coordinator at World Health and Wellness in the country and the program coordinator of EPA and the climate change star and the Lucky Mountain Tribe. Mr. Joseph is going to go first. And then we can speak about this.
Morning. Well, I'm so happy to be here today. So it's great to hear the amazing spectrum of experiences and talents. Today, I'm going to be talking about lead poisoning, the current ongoing problem, and CDC's lead poisoning prevention strategies. Next slide. Lead is a toxic metal and causes poisoning. Lead exposure occurs when a child is affected with lead by swallowing, breathing, and usually lead dust. Even low levels of lead, even low levels of lead can have adverse effects on children. Next slide. Lead exposure is a global issue. It's found just about everywhere. This is a cover illustration from recent journal issue of the American Journal of Public Health. It focused on lead as an ongoing international. The most common sources of lead exposure are lead in paint, typically in buildings built before 1978, lead in soil, lead in water, lead in consumer products such as toys, some antiques, collectible items, jewelry, ceramics, and some imported foods and medicines, and relate to certain jobs and hobbies. Children exposed to lead can experience adverse health effects depending on the dose of exposure. And the dose is dependent on the length of exposure, the amount of exposure, and to some extent on the route of exposure. At high levels, lead can cause nervous system problems and problems with the digestive system. At lower levels, problems involve typically the worst problems are associated with effects on the nervous system, the brain, the kidneys, the blood. And this can lead to cognitive delays in children. It can lead to slower growth and eventually to hearing and speech problems. Next slide. So children are particularly at risk for several reasons. One of them is that their developing bodies, particularly their nervous systems, have less ability to recover from lead exposure, and their physiology is less developed in terms of detoxification processes. They have behaviors that cause them to crawl around on the floor, pick up objects and put them in their mouths. There's often can be contaminated with lead dust, and that gives them high exposure. And when they're exposed, they get more absorption because of their small body sizes. This graphic, you can see that blood levels have declined pretty dramatically in the last 40 years. Going back to the 1970s, the average blood lead level for children ages 1 to 5 was over 15 micrograms per deciliter. And now that's down to under 1 microgram per deciliter. But that's a really dramatic improvement. And that can be attributed to a number of factors. We've had some very important public health policy interventions that have reduced lead in paint, in gasoline. We've reduced lead in plumbing supplies, in food, and also public health programs have been working hard the last 35 years to reduce lead exposure. Next. But there's still a lot of work to be done. There are still disparities in lead exposure in the United States. High blood lead levels are more prevalent among children in certain ethnic and racial groups, especially in households with lower incomes, and among children living in housing with leaded paint, typically before 1978. Children from some racial and ethnic minority groups are more likely to have living conditions where there's a greater likelihood of exposure. There's still more work to be done. Billions of children are still exposed to lead. Adverse health effects and developmental effects are being identified at increasingly lower levels. And children can be exposed to multiple sources that are still present in their body. So focusing on exposures, the main exposures to lead among children are from paint, soil, and water. Paint is in homes and buildings built before 1978, when lead was mostly banned from domestic drink sources. From contaminated soil, and that can come from the lead-based paint on the outside of houses. It can come from decades of deposition from automobiles using leaded gas, and from factories and mines that use lead. And then contaminated drinking water can get lead in it from the pipes or from plumbing fixtures. And that's still a problem in a lot of communities. Of course, you've heard about the lead situation, but it's much more widespread than just lead. I wanted to mention a couple of sources of particular importance for Native American, Alaska, Native American Indian, and Alaska Native populations. Similar to other groups of children around the country, living in older houses is the primary risk for lead exposure in this groups as well. But also, especially in the West, exposure from mining sites and smelters can contaminate soil and water in Native American communities. This can also lead to take-home exposure, where a parent or a family member can be working in a mine or a smelter site and bring home lead on their clothing or on their shoes and bring it into the house, and that then the children get contaminated that way. They're also more likely to be unregulated water sources, and we're going to be hearing more about that from several speakers. And consuming wild game has been shown to increase lead exposure from the use of lead bullets and lead shot. And of course, it's also bad for the ecology. And melting lead for fishing sinkers and other fishing tackle has also contaminated clothing. Again, you're going to hear more about the water, but I just want to mention a couple of things. Among American Indian and Alaskan Native populations, public water systems are less likely to be tested for contaminants. Their populations are more likely to use private wells, and they may have water security issues, which force them to use less pure sources of water. There are two general approaches to lead poisoning prevention. One is primary prevention, which is the removal of lead hazards from the environment before exposure occurs. This, of course, is what we really want to do. This is the only way to prevent long-term effects. But because lead exists in so many places in the environment still, we also need to employ secondary prevention, where we test young children for lead to see if they're exposed, and then try to reduce that exposure and remove the exposure from affecting other children as well. The best way to determine if a child has been exposed to lead is to do a blood test, because most children with lower levels of lead don't show obvious symptoms. There's two types of blood collections that are typically used. First is a finger stick, sometimes a heel stick for a young baby. The advantages of that is that you can do that in an office setting, and the child's family can wait for the result and get the reading before they go home. The disadvantages are that it requires quite a bit of care in taking the sample, which can become contaminated if it's not done properly, giving a false result. If the child tests higher than a certain level, then typically a second test is ordered, which is usually a venous test, where the blood is drawn from the child's vein, usually by a phlebotomist. And that's the best way to confirm an initial finger stick test. That usually though, you have to go to a special facility where they can do phlebotomy for kids, and it takes several days to get a result from that kind of test. So who should be tested for that? Well, children on Medicaid are required by federal law to be tested at 12 and 24 months. If they aren't tested during that period, then during the time from 24 to 72 months of age 2 to 6, they're supposed to be tested then. If children aren't on Medicaid, they're supposed to be tested. Well, CDC recommends what they call targeted testing, where children known to be at high risk or who live in high risk communities get tested. I should note that a lot of states have additional specific requirements for lead testing in their jurisdictions. Based on the child's blood level, the clinician might provide education on the sources of lead and ways to prevent lead exposure, and might monitor the child's growth and development, assess the child's symptoms, refer the family for remediation and lead inspection, removal, initiate medical treatment if appropriate, and make referrals for supportive services, so perhaps enrollment in a Head Start program or other kinds of developmental programs that would help us with it. Also, I want to mention a few things that we can do to prevent child lead poisoning. Make your home lead safe, especially this applies to older homes. And typically, the older the home, like houses built in the 70s, aren't quite as bad as houses built in the 40s and 50s. The older the house, typically the more lead it has in it. Use lead safe practices when renovating. This is a particularly risky time for exposing kids to lead. People often do room additions or renovations when they have the babies, and that's when lead dust can accumulate inside and expose siblings and newborns to lead. That's hard to mediate that once it's already in compliance. So it's best to use certified professionals who are skilled and professionally trained to do those kinds of renovations. Also, regularly, sort of obvious, but regularly clean floors, window frame, window sills to reduce lead dust. I think the use of waste mop, and cloth, rather than spraying the lead around, that's the best way to do it. Remove your shoes when you enter the house, especially if you work in a lead environment where you might be exposed to lead on the job. Also, when you get into the car, it's a good idea. You don't usually take off your shoes before you get into the car. And sometimes people have a spare pair of tennis shoes or something in their trunk they put on when they drive home rather than using the work boots. Check your drinking water. You'll hear more about how that can be done. And cover bare soil with grass, mulch, or wood chips, especially in areas where kids play. That's an important strategy. More items. More things you can do. Provide a nutritionally balanced diet with food rich in calcium, iron, and vitamin C. This can help prevent lead absorption. It also helps with detoxification processes. Wash hands and toys. Dogs too. Make sure your products do not contain lead. Use lead-free ammunition and fishing tackle. Wash your gathered foods before cooking or serving, and test your young children for blood tests. If you have a question about whether your child should be tested, then ask your doctor. Are there particular issues with access that make childhood lead poisoning more difficult for Alaska Native American Indian populations? Families may need to travel long distances for blood lead testing and follow-up. There may be limited lab capacity and dispersed environmental staff. Sometimes a lack of cultural competency among medical professionals. And the families are more likely to be uninsured. So these are all barriers to doing effective lead poisoning prevention, but that's what we're here about. Next. The CDC is trying to lead poisoning prevention branch, which we call TIP. Our vision is to eliminate childhood lead poisoning as a public health problem. And our immediate mission is to reduce blood lead levels in children and differences in average risk based on race and socioeconomic status. Our strategy focuses on four core strategies. Our program focuses on strengthening four core strategies: blood lead testing and reporting, surveillance of children's blood lead levels, targeted population-based interventions, and linkages of lead-exposed children to recommended services. We're doing a lot to try to increase blood lead testing. I mentioned that Medicaid children are supposed to be tested at 12 to 24 months, but in reality, many are not, probably half or more. So we instituted a few policies to try to improve that testing rate. It was made more difficult during the COVID period when clinics were closed, and a lot of children weren't being seen for their annual visits, periodic child visits. Also, there were some problems with some of the devices, and there were recalls on some of the testing kits and devices. So there was limited access to some of the testing strategies. So one of the things we did was to lower the blood lead reference value, which we call the ELRV. We lowered it from 5 micrograms per deciliter to 3.5, and that opens up more children getting services and eliminates the problems with lead, the reality of lead toxicity at lower levels than was previously recognized. We're boosting up our surveillance and epidemiology to collect better data. We're doing communication and outreach to pediatricians, and we've got some training videos that are going to be going up online that you'll be able to access for free and on demand download. We're working hard on our partnerships with all levels of government, tribes, with other parts of the federal government, EPA, House and Urban Development. And pediatric associations, all to try to improve the testing. And they've got something which we call the lead exposure risk index, the LERI, which is a web-based mapping application that incorporates data from all kinds of different sources, from air toxics, soil, housing, we look at demographic factors, we map all these in different layers and come up with essentially a risk score for each census tract that indicates what the likely level of lead risk is in that area. So that'll be going online sometime this year. We're really excited about that. Next. So CDC currently funds 48 states, several territory of Puerto Rico, Washington DC, several cities. So the only states we currently don't fund are North Dakota and Arkansas. We don't have any specific funding for tribes, although we did open it up for tribes, but we didn't get any applications. So we can talk about, how we can change that. That's something we really are interested in doing. So we mostly traditionally have funded the states to do surveillance activities, but we broaden that out now. We're funding more local and health departments, community-based organizations, hopefully tribes to do primary prevention and other interventions that are local level. I want to put a plug in as epidemiologist for reporting. Data is really important, and if we can't show that there's a problem, it's hard to call attention to it, which means it's hard to get money for it. So I encourage those of you who work with tribal data to make sure that the data get reported to whichever agency that you use. We usually get our data from the state, so ideally to send it to the state health department, and then the states send it to CDC. That's how it works. It's very difficult to get direct reports from every tribe and every local health department. It's already complicated enough to get it from all the states. So I do encourage you to report blood lead tests that you have in your systems to the proper health authorities in your area. It creates the opportunity for earlier interventions and referrals for the affected children. That's the most important thing, not just for us to get the data, but for the kids to get the resources that they need. Can help identify sources of lead in products and communities that we might not have known about. It can help prioritize communities for effective prevention activities. And importantly, provides an opportunity to collaborate with state and local health agencies, which I really consider a very important factor in this. CDC does a lot of partnership activities. I don't want to go through every one of these, but we work on strengthening primary secondary prevention. We look to see among programs that are not currently funded, what we can do to get them funded. We work on capacity building in jurisdictions to try to enhance surveillance, as I mentioned. We're working to promote community engagement and health activities. This is a very important part of what we do. Looking to the future. So we're looking for ways to, as I mentioned, to increase funding and strengthen outreach. The submission applications from tribes to do lead poisoning prevention. We really would like to see it. We've been partnering with organizations like NASCO and EPA, referencing the resource work, and we want to work directly with tribes. I hope we get an opportunity to get together while we're here today. Okay, summary. Children can be exposed to lead from various sources in their environment. Some of those sources are more important than others. Protecting children from lead exposure is important for lifelong health. A blood test is the best way to identify a child with exposed. CDC is committed to eliminating childhood lead poisoning as a public health problem, and CDC is very interested in partnering with that. We have a lot of resources available on our website, cdc/gov/ncbh/lead. I have a lot of good stuff there. I'm not going to go through all this now, but I can give you the website reference later. That's it. Yes, thank you. Thank you for your attention and thanks to all our colleagues involved. You want to do questions? You want to do questions now or? For now, okay. Yes. Is this one? I hear you. Okay. Thank you for the presentation. So you mentioned earlier in the presentation about homes predating 1978 that have led to the paint, I suppose that's both interior and exterior. I wanted to ask the question and also make a statement. Question is, does this also apply to mobile homes or some type of modular homes that were built around that area? I say that because of the western neighborhood, a large swath of it is what we call the Bennett Freeze area. Now it's a former Bennett Freeze area. It's a land dispute between the neighbors and the Hopis that predate at least 40 years of no 40 years with the neighborhood that prevented building into to existing buildings. So there's a lot of mobile homes that were brought into that area, especially around Camden to the city area. Nobody can build a home because of that law of the land that was frozen. So I'm wondering if some of those mobile homes are still there. And I know that the folks still live in it, passed on generation to generation. And I see kids living in those mobile homes. So I wanted to ask that question. Thank you. Yeah, that's a good question. Can you hear me okay? Is this on now? How's this better? Yeah, that's a great question. Manufactured homes, generally speaking, we don't consider them at higher risk because they don't have wooden surfaces so much. However, a lot of houses have built-on porches and things that were built in the early 60s and 70s, and those could have been painted with lead paint. Some of them have drywall inside. That was where the exterior probably not, but the interior drywall could have been painted with lead paint before 1978. So we don't see a huge problem with manufactured homes, but I wouldn't dismiss it. You know, there are fixtures in there. There's doors, wooden doors that could have been painted with lead paint, and you know, shelving, all kinds of things. You know, it's not just the shell building that's at risk. So thanks for asking that. Other questions? All right, oh, got one more.
How do you guys dispose of the buildings? Are you just one standing or how does that taken care of?
Well, there are millions of them, so billions of people living in them. So and we have a housing shortage in this country. So it's not an easy question to answer. You know, the best we can do at this moment is try to contain the hazard, try to educate families about reducing the risk for their kids. Gradually, these housing units are being replaced, but you know, there's a lot of nice houses from the 40s and 50s and 60s that, you know, there's no reason to tear them down if they have, you know, if the lead is kept, if the paint is kept in good condition. You just need to be careful when you're remodeling it or recleaning it, that you don't chip it off or water it. But, yeah, I mean, it'd be nice if everyone had a new house. But I don't see that happening anytime soon. Anything else? All right. Thank you.
Again, I'm Ada Benz. I'm the program coordinator for the Wind Tribal EPA water testing for lead program for public schools, tribal schools, any kind of schools within the boundaries of the Montana, Wyoming tribes and reservations, and it includes early childhood centers and daycare tribal centers. I have a cheerleader's voice, so I was a cheerleader for quite a few years in my life, so sometimes I don't need a microphone. And I was hired, I do this as a part-time. And what we did was we introduced this grant or this subaward to all the tribes of Montana and Wyoming. Go to the next. These are the tribes that we work with at Rocky Mountain Tribal Leaders Council. And each of the tribes within the grant frame were invited to participate in this project. And in all the public schools within the United States were required to do certified public school lead testing. And that was to be done December 31st, 2021. And we started this project October 2021. Next slide. This is a picture of the service area that we provide for Rocky Mountain Tribal Leaders and for this water testing for lead. Black Creek Reservation up in northern Montana, northeastern tribe of the Assiniboine Sioux, Fort Peck Reservation, the Upsaloga in the south central part of the state of Montana, and then in Wyoming, the Wind River Reservation, the Eastern Shoshone tribe, and the Northern Arapaho are the 5 tribes that Rocky Mountain Tribal Leaders works with right now for the water testing for lead. So what we do is we make sure we started out, we sent out the information, the invitation, and then we did site visits to all of the ones who were interested, and we've continued to do site visits. And we continue to do one-on-one calls and emails, and the communication is so vitally important. And every tribe that we work with is unique. It's like going into Europe and you drive into the country of Belgium, which is split with Flemish and French. You go into Germany, totally different. The same is for every tribe here in the United States and in Alaska Native villages. That's one of the things when you talk about diversity. Not only does the United States of America have diversity of individuals that come from all over the world that live here in our country, you have the unique, beautiful diversity of all of these tribes here throughout the United States and Alaska Native area. Unique, diverse, I do not go into any tribe and assume anything. Even with my own tribe, the Apsaloga, I don't. Because I'm always learning. I do not have the right to go in and pretend I know anything about the tribes. Because first of all, the respect that I was raised with to go in as a visitor. The key to this is to sit with the tribes, the people within a community, and to hear their stories, their voices. That's so important because they're the voices who are dealing with the potential health disparities coming from the environment and climate changes. You heard this morning from Audrey, her passion. You talk about data, how important it is. That's an important piece of data, qualitative data that she just shared. You hear these stories, you go into the homes. I used to work with John Doyle and the Co-Environmental Health Committee with Mari Eggers. I was given the great opportunity to be under their guidance. And we went into the homes and tested the water on our reservation. We went into the ponds, the rivers, the creeks, and tested the water. We walked into the homes where the elders had to change their coffee pot every month because the water got so clogged, the refrigerator. I brought this glass of water up because bila wakpag. Bila iwalay wakpag. Water is sacred. Water is how we are here today as people, human beings. You see within this, I put fruit in there because that's part of how where water helps the food to come. I put my sage in there. I put a piece of bear root in there. Medicinal plants on our homelands. Every tribe has medicinal plants that grows in their lands. These are medicinal plants of the Apsaloga. These we smudge and we clear ourselves. We pray with this. During COVID, they took those medicinal plants and made teas with them. They make packages of tea. They went to our mountains, the streams. You integrate the cultural piece because we're so connected to the earth. Our body is almost made a large percentage of water, Bila. That is so important to the health and future, presently and to those yet unborn, of how this sacredness of water is going to impact our rivers, our aquifers, our ponds, our homes, our buildings where our children are going to school, our babies that are going into the tribal daycare centers, our young mothers, our elders, our people who go into the facilities to go for health care, to go into their tribal housing units. Even today at Crow Fair, our tribal fair right now, our children jumping into our river The testing that went on a few years back was a high E. coli. Co-environmental health steering committee at that time sent out information, education, awareness. The fish were also contaminated or getting, they put out, certain inches of fish in one of our reservoirs. Impacts through the pesticides. Yes, the issue is also of water for the levels of where the wells are dug in our homes. 20 feet, 40 feet, surface water. So if that happens with the units, you question whether or not, my question is, how far are the wells built for our tribal daycare centers? For the schools who are not certified under public schools for the state of Montana. For those tribal language schools. Not only do we learn linear education to advance our knowledge, we also have ceremonies. We also have plans in our way of life. Every day, our people are exposed to the environment. Every day they go hunting in our mountains and our prairies to find their food. Every day they have to see and know or unknowingly know that the pesticides that flow into that dirt next to their home, or the airplane that comes and sprays and you're standing there, your children are playing outside, are exposed. The hut homes that my late sister, my baby sister, lived in was built in the 1970s. She died of intestinal, lower tract, and upper bowel cancer. She was misdiagnosed with pancreatitis. She was at a training in Reno, Nevada, and it exploded. And she went into emergency surgery, and we as family, we got together and we went down there. Those pipes. And today her husband still lives in that house. With the same pipes. Our sacred ponds that we go and pray at and leave our offerings, we found out was contaminated. But yet our children go and play. Yes, there is an issue. It is a big issue. And you have to hear the voices. Please hear the voices of our communities, of our elders who are our people that are sitting here, the tribes that are represented from the Southwest, all the directions that they come, it's important. What Shpolashtil is a value that I grew up with. To have compassion and to care for each other. That is the key. It's not a lip service. It's our way of life. So when this grant came up, next slide, please. Because, you know, this was an opportunity, and because the opportunity came from John Doyle and Mari Eggers, for me to be able to learn and do faucet testing. That gave me the background, and to be a part of that co-environmental health steering committee, I did research on my own on the impacts of water all the way to the photons. Because I wanted to know. That curiosity took me way into the depth. And I found out past the photons is this invisible energy that the Apsaloge call Bawach Besh and Bachahor Bajistich. That sacred energy that moves everything. And so the work that the tribes do with the ones that are part of the water testing for lead. We have a couple here. Clinton Glick from the Eastern Shoshone Tribal Health Department of the Wind River, Wyoming, if he could stand up. Wes Stops, the EPA Tribal Department for the Apsalaga Crow Tribe. Is Amanda White here from the Northern Arapaho? The Blackfeet was, he was on travel. And Fort Peck had another event, so they couldn't make it. So these are the tribes that this water testing for lead. And you know what? They went out, thank you. They went out and they counted all the faucets for their sites in the tribes. For every school in their vicinity, and we found out the state of Montana did not do the certified public schools in some of the tribes. But this grant will allow that opportunity. And so also, they went into the Head Start centers, they went into the tribal daycare centers. They did a lot of legwork. Just like traveling all to these tribes that I showed you, that's the same way. Currently, we are waiting for the approval of the quality assurance. They're ready to go. Once that's get approved, Energy Labs here in Billings, Montana, will be providing water testing kits. We have a national EPA tribal water testing for lead monthly meeting, and we update the national EPA office of our progress and the Region 8. Our grant writer Corbin Shanbury from helped write this grant. And so we're just at the starting phase. And I'm really, really happy to be able to do that. Next slide. This is just the funding that was given. And our goal is to help with the remediation. And we were told at our national EPA monthly meeting that there is money going to be available that tribes can apply for remediation. If they need to, when their testing's done. This is a picture of my tribe. This is intergenerational. It's the Crow Fair Parade. It's right where we camp. And this is a flashback because we live in both worlds. All of us as Indigenous, American, Indian, Alaskan Native live in both worlds. We represent who we are through our languages, our ceremonies, our way of life. Every day we get up and we pray and we're grateful. A lot of these writers have masters, their doctorates, their bachelors, their associates. There's elders, there's young people, there's hunters. There's people that work in the mines there. There's people that work in education in this. There's young ones who are in school. Intergenerational representative of our people. Next slide. I've already went over this part. And It's a learning process. It's an opportunity. And I really appreciate the input that tribes give us at Rocky Mountain Tribal Leaders. And the collaboration that you want to have with tribes. If they don't answer, if they don't participate, then like you said, hit that number 1 on the dial. Hit that, number 3. You'll get somebody, believe you me. And they know somebody who knows somebody who knows somebody who can get you connected to the tribe. Each of these representatives who I work with, not only are they working for the water testing for lead, my goodness, they have a huge, huge responsibility. And they're only one person or 2 people. They're trying to take care of the health of our tribes. Next slide. The project goals is K through 12. We already talked about that. Preschool. They gave us all the information, the EPA. We meet with the tribal health directors whenever we do our site visits. The tribal health directors report to the Tribal Leaders Council. I report to the health the health committee on the tribal leaders quarterly meetings. Next. This is my grandson. My son's name is Derkash Pajesh, Eagle Man. His name was given to me when I was 4 weeks alone. My son came to me and I became a single parent because I chose to. He came to me with blonde hair and blue eyes. I was related to everybody on the Crow Reservation, so you know what can you say? And this is his son, Timber Paul. Timber Paul, mama is half Crow and half Benin. And they go out to the Big Horn River and fish. We assume when we go out to our tribal lands, rivers, ponds, creeks, we assume when we go into our schools, our daycare centers, our Head Start centers, our tribal daycare centers, we assume when our children approach the waters that they are lead-free, healthy, and safe. We assume as parents, as grandparents, as tribal members, that when they approach and get ready to fish or swim, or go in to learn their ABCs, that the water that they drink, wherever they are, 24/7, is lead-free. See that? This is what inspires me. My grandson. Bishpabida. In our Crow language, Apsalogan language, we have no words for cousin. We have no words for uncle or aunt, as many of the languages do. There are mothers, our fathers. There are children. We're interconnected, just like you're interconnected to the environment. Their degrees, their background as EPA, tribal programs, They take that knowledge from the linear and they take it and they work with our tribes. Living in two worlds, they go back and forth. How intelligent is that? Because they have to interpret. I worked for a time for the National Institutes of Health through MSU Bozeman, a term that took me almost 6 months to say. CVPR, Community-Based Participatory Research. When I presented that, some of my elders said, Santa, what did you say? And so I said it again, but I read Congressional 1 and 2 of why I had to do CVPR health disparities. Because every terminology that we receive from the funding, that grant comes into our programs, our tribes. And we have to interpret for our Blackfeet elders, for our Salish elders, for our Kootenai, our Crow, our Northern Cheyenne, our Assiniboine, Sioux, Grovon, Shoshone, Arapaho. We have to interpret back to our people. Show Jalen. They challenge me and they said, they ask us questions, they say this, and they write it down on their paper. They take it, they close their books, and there they get in their car and they leave. And we never hear from them again. So to have the empowerment of our Native and American Indian and Alaskan Native people to get that degrees, Shay, is so important. Because no matter how much experience you have in the linear world, you still have to have those lines behind you. At home, when they say, Isaba, they want to know what your name is, what community you're from, who your clan is, and who your people are behind you. And then you turn around and then you tell them which family. So we live in this dual world that's so beautiful because I speak to you in my language, but I'm translating right now in English. We live in a holistic, so this makes so much sense being holistic in environmental health and climate. And this little bit of money that we receive, may it help the tribes that we're have partnership with. The key is, what do they do if they find when they're testing results? The remediation. You talked about testing the children. How available is that for remote villages or remote sites? Think about that. When you're going to consult with the tribes, think about the distances. So go ahead to the next one. The 3 key models is, everybody knows this, to train, to test, and take action. And so each of these partners, they've contacted the schools, the Head Start, all that they need to do. They're the ground workers. And I commend them for all their hard work. I really respect them so much. Next. The challenges that we've had since this grant came into Rocky Mountain Tribal Council was this, and the tribes that deal with this too, is the staffing, because they have tribal elections every 2 years, every 4 years. That's a challenge that all tribes have. Then we had C-19 and tribal shutdowns happen. That was really hard for all of us because in our cultural way, we sit with our people. We couldn't do that. We couldn't have any closure to the ones who are loved ones. The tribe still functioned. They still went out and did the work that they had to do, the frontline workers. The weather, if you've been around our region, minus 50 below is nothing to us. Road closures, 80-mile-an-hour winds. Here in Montana, in our region, when you go somewhere, you've got your sandals, your rain boots, and your snow boots. Because within a short time, it can change. And if you're gonna go out there and test a remote part of your reservation at a tribal daycare center or Head Start center, you have to have that gear. And you have to have the tires to be able to go and come back. That's a reality for us. So that happens. And rural. You talk about if there's a percentage of lead in one of the children. Whenever you go to your clinic, then you do the testing, then you're referred. For us, we have to come all the way from Wyola, which is probably west, 90, maybe 100 miles one way. Yeah, just one way. And if you're referred here to Billings, then you have to drive that way. Same thing with Blackfeet, same thing with Salish, same thing with Rocky Point, same thing with Fort Belknap, same thing with Fort Peck, same thing with Northern Cheyenne, same thing with Northern Arapaho, same thing with Eastern Shoshone. Rural, 4 to 6 hours from Billings, 10 hours. Then if you're referred to a medical center, then you add Denver, Salt Lake, those areas. But you know what? The resiliency of our people is phenomenal. And so those are the things, the challenges in this. People are going, what are we gonna do if we find lead in these pipes? What about the lead in our homes? Think about those and the collaboration that you do. In our clan system, we're told the clan system is like driftwood lodges. In the river, you see a driftwood come and another one come and it entangles and another one and you try to pull it apart. That's the way it is in our communities because we're intergenerational. But your work hour will mean to look out for each other. But your Wajasur means we love each other. When you go to the Crow Fair this evening, you will see the encampment. And believe you me, you're gonna see horses and kids and they're gonna run in front of you. And it's the most chaotic, organized chaos you'll ever see. And people are laughing and running, and if you could have been there, you could have seen them, listen to the camp crier. We live in an extraordinarily beautiful world. And this is so important. And I appreciate the opportunity to be able to come and present and just give you just a little tiny bit, a speck of what our world is in Indian country. And I challenge you, words are sacred. If you cannot provide the reality of services of the crisis that needs to be done for our homes, our schools, our daycare centers, then don't give us those words that you can. Let us see your action. Let us see your follow-up. Like the elders said, what did they do with that, all that paperwork? And I'm just so appreciative of this opportunity because I'm a student learning. Quentin Glick, West Stops, Amanda White, all of these EPA, they're my teachers. They're teaching me. They're my guides, just like John Doyle, Mari Eggers, the Pro-Environmental Health Steering Committee. They were my teachers, the elders, they're my teachers. The people are the voices of our people in our communities. I never assume I know anybody because I don't even know the full scope of my own culture. I consider myself a little fifth grade speaker. And I'm always willing to learn. So look at these challenges and look at the opportunities because the resiliency of the American Indian, Alaskan Native villages is so powerful. Observe it, learn it, because we're still here. And we'll be here for just another 7 generations. Next slide. This is the Bighorn Canyon on the Pro-Psaloga land. Bila Bach Bach. Water is sacred. This is one of the creeks in the Absaloga lands. Bila Bach Bach. Next. This is some of the buffalo way up in our mountains. They live and stay and eat in pristine environment. I'm not sure how many we have, but every tribe has their herd. This is our food, our life. Bija is how we say it in Crow. And we heard earlier about pesticides. We heard earlier about the sprays that come in. We heard earlier about the impacts of mining or all those things, how homes and stuff. Not only do we have to protect ourselves, we have to protect the water because the livelihood comes from our mountains, our lands, our aquifers. We give thanks to all that is in nature and natural in our native language, native indigenous lands. We're all connected, whether you live in Atlanta, Georgia, Washington, D.C., whether you live, you know, in Heart Butte, in Wolf Point, Poplar, doesn't matter. We're all connected. All of you provide a service for the people that you serve in our tribal communities. Remember, and I'd like for all of the American Indian Indigenous people to stand up, please, right now in the audience. These are the nations. These are the tribal nations that you fund and provide services for. Their elders, their children, their adults, their relatives, their lands. Please meet with them. Please reach out to them. Please talk to them. Please shake hands with them and hear their voices, because their incredible knowledge and wisdom is the greatest gift that you'll receive into providing the services that you're going to provide in our region. Aho, thank you.
Sorry, everybody. Yeah, but I do have a question. With the lead testing, you know, that's very concerning. What are the results? And when will they be, or if they will be available to the public? I have children, I have grandchildren that are in those schools in Blackfeet. And that is very concerning. And as a community member, I have a right to know, I have a right to step up and do any prevention that I can. So when will those results be available? And where, or if they're available to the public on which schools have been tested? I would like to know that as well.
With the state of Montana, you go into their website at DEQ and they will have a list of the public certified public schools that have been tested and done by December 31st of 2021. And the results for this one, we are ready to go. The water testing kits are ready to go. There's just two little glitches of the quality assurance project plan of the QUAP that have to be done. And the Region 8, Cynthia Gonzalez and Troy Hill, once they approve that, they're ready to go. And I will get on that, I promise, this next week. And once the results come back, they will go directly for each site that was tested. As soon as the testing comes in, like maybe, example, one of the schools, Lodgepole School. He goes in, he tests, he sends a kit back, Energy Labs does the testing, they send the results directly back to Wes. Same thing will happen. It'll come back to the our epicenter. But they are not shared by anybody. No other tribe will know. That's their information, and they will get the information out to their community as soon as possible. So, Marvin, did you want to add more to that?
Oh, I just let her know, if you really want to know about that land hospital. Yes, that is those. I was just gonna relate to her that if you want to know more about the lead or copper testing, so everyone has to do it, and tribes
as well, so. You can get a hold of your water treatment operators, or drinking water, or wastewater treatment plants, and they will have all that information for you. They have to do that testing monthly or quarterly, and so they will have it for you. You can also look at like, they call it a consumer confidence report that lists all of that for you. But yeah, this is more like an initiative where we are doing lead, right? Because EPA is just did a new rulemaking for lead service lining initiative, our inventory initiative lists. So we're gonna have to do all that as well. I think everyone is.
Let's give Ada a hand, everyone.
So I just have one more thing to say. I know this lady's asking about the results for the lead water testing inside the school facilities. And Wes here, I think he was telling her about the water testing the treatment plants do. But that's for the water that comes to the treatment plant and then goes out. So then that's the water that's tested. The testing we're doing is kind of like what water comes from, the water comes from the treatment plant into the building. We're testing right at the spigot inside the school, so we'll know what comes to the school. The other one, you can get the information off the EPA watches the water testing for treatment plants and stuff, and they do put that out there. That's totally different from what you're gonna get. The result is inside the building. So you're gonna have to, once all of the testing's done, I'm pretty sure that we'll work with Ada, the epidemiology group for tribal leaders, and then what's his case name?
We're National Indian Health Board.
Yep, National Indian Health Board, and then that's how we're gonna get the information. And I think if there's serious issues, I think the school boards or whatever will work with EPA to do remediation, and that's when they go in and fix it. That's, and I think that if the spigots or whatever levels are way too high, they'll make them shut them spigots off so that nobody else uses it until it's remediated. Sometimes that lead pipes are out in the streets, It's not the actual building, and the lead might be coming in from outside that building. Yep. Could be two water lines going into one building too. There you go.
So thank you for that. And thank you again, Ada, for your wonderful presentation. Next on the agenda is our lunch break. We are a touch behind, but I want to give everyone at least an hour for lunch. So can we all be back here at 1:40? Sound good? Awesome. And I encourage you to take this opportunity to network, get lunch with someone you don't know and build those relationships that we were talking about earlier and build those knowledge bases and those different diverse backgrounds and things like that. So definitely encourage you, but most importantly, be back here at 1:40.